WSRB and WSRB HD Lansing, Chicago, WYRB and WYRB HD Genoa, Rockford, DeKalb, Soul 106.3.
Stay tuned for the Jeffery Leving Father's Rights Legal Show with
Here we go.
Attorney Jeffery Leving.
This is Attorney Jeffery Leving with the Jeffery Leving Father's Rights Legal Show. And today we have Congressman Danny K. Davis here. He just met with President Barack Obama on the historic health care bill, and now he's here to talk about it. Back from Capitol Hill with President Obama. Congressman Danny K. Davis serves on the Committee on Ways and Means and the Committee on Oversight and Government Reform, and Congressman Davis was at the table as many of the provisions of the health reform bill were hammered out, and he's done, I have his bio here, and it would take me an hour to read it. He has 2 doctorate degrees that he earned. He has 6 honorary doctorate degrees. He was a civil rights advocate before seeking public office. He had a highly successful and productive career as an educator, community organizer, health planner, administrator, and there's just so much to read here. It's unbelievable, but the key here is if you go onto his website, you can get all this biographical information, but it's my pleasure to have Congressman Danny K. Davis, somebody I respect. I've voted for years, even though I'm only 1 vote, and he's a good friend of mine, and it's great to have you here.
Well, thank you. Let me tell you, Jeffrey, every vote counts, and I appreciate those votes when they come in one at a time. But let me just say that I am delighted to be here. I do listen sometime to your show, and of course I am aware of the tremendous work that you do and continue to do in the promotion of what I call responsible fatherhood. We actually have a bill that is pending in the House called the Responsible Fatherhood Initiative that I introduced along with Representative Julia Carson some years ago from Indiana, and that now President, but then Senator Barack Obama introduced it with Senator Evan Bayh from Indiana in the Senate. And many of the provisions in that bill and many of the concepts are based upon the work that you have been doing for a number of years, trying to reconnect in many instances fathers with their families, fathers who have been absent, and fathers who have not known that their presence and interaction in the lives of their children makes a tremendous difference. And so I want to thank you for that, and I am indeed delighted to be here.
Well, thank you, Congressman. It's great to have you here. And even though we have callers, I'd like to hold off on the callers just for the beginning of the show because it's so important to have Congressman Danny Davis here. Now, the health care bill is very, very significant. And how historic is the health care bill and why, Congressman?
Well, let me tell you, there have been presidents trying to do something more serious with health reform in the United States of America since the days of Teddy Roosevelt. Every president right down the line has acknowledged and recognized that there were millions of people in our country who did not have access to health care. The biggest jump and the biggest bump that we really had was in the 1960s when the health rights programs were initiated, when we were able to pass Medicare and Medicaid, basically as a part of the War on Poverty initiatives. The legislation that we passed last week and that the president signed and is going to finally totally sign on next week, and I have an invitation to that signing. I don't think I'm going to be able to go, but it's so much fun to get an invitation to these things. But this is the most significant health care legislation that we have passed since Medicare and Medicaid. anytime you can provide access and coverage and insurance for 32 million American people who did not have it before, that's a big jump. And I've always been taught that you can kind of measure the characteristics and the character of a country by how well it treats its old, how well it treats its young, and how well it treats those who have a difficulty taking care of themselves. And this bill does a great deal for all of those individuals and families, and I'm just delighted that I was able to be a member of the United States House of Representatives at the time that we passed it, and I want to thank all of the people in the 7th Congressional District who have given me this great opportunity.